Hi, welcome to another Deep Sea Foundation video where we talk about various topics on breast reconstruction. I'm very honored today to have Dr. Minas Chrysopoulo from PRMA in San Antonio. Welcome, Dr. C.
Thanks, Terry.
Yeah.
Good to be here again.
It is. We're actually in San Diego at Plastic Surgery, the meeting. We've hopped around to a few meetings together. It's been a good meeting.
It has.
You've had some great presentations here that I've enjoyed.
Yeah, thanks.
Yeah, and one of them you mentioned. We talk a lot about the breasts. I want your thoughts on the discussion that you've had here at the meeting about the belly.
Mm-hmm. In terms of after DIEP flap reconstruction,
Yes, thank you for clarifying that.
Yeah,
yes.
No, I think obviously the focus has been on the results after breast reconstruction, primarily looking at the breasts, historically, traditionally. That's why the patient is having the procedure, so that's where the focus has always been. But I think really the conversation about the belly is well overdue. As plastic surgeons, we all perform cosmetic surgery, and I think it's time that everyone really views reconstructive procedures as much as we do with cosmetic procedures. We view the aesthetic results. It's not just our technical prowess to take tissue and transplant it and reconnect it and use microsurgery, and we get kind of really caught up with the technical expertise that's required. And
Right.
I think sometimes as a specialty we forget about what's really most important, and that is what the patient is left with looking in the mirror for the rest of their lives. And so those results extend beyond the breast. So for the belly, I think we really should be shooting for results that do mimic a true tummy tuck. We already talk about the DIEP flap being kind of like a tummy tuck. Unfortunately, for many practices and for many surgeons, that can sometimes be a little bit, overselling, because a lot of DIEP flap patients do end up with a tummy scar that's higher than a true cosmetic tummy tuck. A true cosmetic tummy tuck, the scar is really low. It goes down to the hairline and then curves up, but it's something that's hidden with most underwear in a bikini. Sometimes we can't do that. We can't get those results
For a number of reasons.
for many reasons.
Yes.
We put out a good blog post about it actually on the PRMA blog in terms of
Okay.
reasons why you can't always get that lower tummy scar. But what I'm saying is we should be shooting for it. Okay, that should be our goal. And the same with the belly button. I think the days of these kind of ugly, round, kind of stamp-like
Stamped.
appearance, we need to move on from that. So we're really pushing for that now to maximize the cosmetic outcome of everything. Let's try and make everyone look as close as possible to a mummy makeover. Obviously, there are things that patients can't control. There are things that we can't control. If radiation, having a reconstruction after the fact as opposed to an immediate reconstruction. On the belly, on the abdomen, if you're having a DIEP flap, we can't control where your best perforators are. We can get CT angiograms to evaluate where it is, where the best perforator is for us to choose. Sometimes your tissue distribution over the lower belly doesn't allow for the lowest scar. So there are multiple reasons, and this is part of the shared decision-making conversation ahead of time, because for some women a really low scar is a top priority, and for others they couldn't care less.
Right.
And so we see a number of women who say, "Oh, doc, do what you've got to do." And some women say, "Oh, well, no, actually wearing a bikini is really important to me."
Right.
So then, in that second lady, maybe a CT angiogram is now something that we need to get instead of just a consideration. we need to get to really look at where the perforators are and plan that abdominal incision. So case by case basis, but the take home message is have the conversation with your surgeon. Where's my scar going to be? What are you going to do to help get me the best cosmetic result, and what should I expect?
Yeah. You fast forwarded to a question I was going to ask you, what conversation to have. And so you just nailed on that, because, I think sometimes, especially, well, there's no differentiation, I don't think, but I just think sometimes women don't think about the aesthetic details to ask their physician, because I know I wrote a blog on that too, and it's important. They just don't, I don't think they have that list in their mind sometimes.
Yeah, and also, we don't help, as in terms of the messaging that surgeons have been putting out for so long. When you tell someone it's like a tummy tuck, it's you've got to be careful. You're a teacher. Words matter, right? I mean,
yes, and that's why I like to give these vocabulary to. So
you've got to clarify it. Yes, in some women it does look like a tummy tuck.
Right.
It can.
Right.
But
that's not what you're going in there for. So that's the reality of it.
Right, but if that's what you're expecting and there's no chance you're going to have it, you should know.
Yeah.
Right, and so let's shoot for that. Let's optimize the cosmetic outcome of the belly as well as the breast. But let's just get on the same page.
Yeah.
It's really the same issue as when as surgeons we tell people, oh, your breast will feel natural. Right. We've had this conversation about sensation.
Yeah, we did a good video on that too.
It will feel well, to whom, right? Right. But anyway, so
that's good stuff.
Yeah. So thanks for doing this. I think it's a very important topic.
Oh, thank you.
With the surgeons, and
I'm glad I saw you down at Starbucks so we could sit down and get this video quick. Yeah. Oh, that was a plug, wasn't it?
They're not
Sorry.
paying me.
Yeah, me neither. But their coffee's good, especially when you're at the meeting. Hey, thanks for joining us this morning.
You're welcome.
Be sure to like our videos and give us a comment. Let us know if there's other topics that we can cover for you. Thanks so much for joining us.
You're welcome.
All right.